17th of April 2024, and this is my first interview in a podcast studio here in central London at Somerset House, and I'm with Dr. Bharat Pankhania, Senior Clinical Lecturer at the University of Exeter. Thank you so much for being my first guest. We have a lot to talk about. Really, the focus of this podcast is media trust and bad journalism. It's very, very serious and something I'm very passionate about. I'm a mother of 3 children. The whole environment now on the social media, if you want to call it that, or mainstream legacy media, whatever you want to call it, it's about the decisions we make in relation to our health. Who do we trust? And I put a post out. We connected last year, and I put a post out, okay, and I asked people if they wanted to comment and put their questions to you, okay? Is the COVID vaccine causing excess deaths? Did the mandatory enforcement of lockdown masks and vaccine passports help to protect us? And you're willing to answer some of the questions and comments that have been put forward by some of my followers. You know,
Sure.
I've got 300,000 followers.
Wow.
And
Yes.
I know we've connected because we both got concerns with GB News, for example. We don't think it's been called news, but it feels more to me like an opinion channel or a YouTube kind of channel. And I think it's causing some confusion for people. And I was very concerned about that from the beginning.
And many other outlets, including unregulated YouTube channels,
Yeah.
etc. And a lot of people can get online these days and start broadcasting, and it causes confusion, it causes worry, anxiety, and people are not everyone is scientifically trained, so they don't know.
I'm not scientifically trained. I have to trust someone.
Yes.
You know, when you
yes.
talk about virology or immunology, or should I take this vaccine, or should I stay in my house, or wash my shopping because there's a deadly virus out there, I need to know who I can trust.
Yes.
And that's at the heart of any issue, really,
Yes.
whatever it might be. So just to really introduce you then to the audience. So this is Dr. Pankhania. He's worked in public health medicine for over 25 years. He feels that better health is often derived by a better informed population, able to make their own judgments and decisions.
Yes.
So, and you are, teaching, training and mentoring have always been Dr. Pankhania's forte. He has been the training lead for health protection at Public Health England, South West region. And you've also held honorary teaching positions for over 15 years with superb feedback at the University of Bristol, Imperial University, University of St Mark and St John, and the University of West of England. And you started your new post at the University of Exeter in 2017, and you're head of public health medicine teaching there. Is that all correct?
Yes.
And we've had a chat before recording. You speak from the heart.
Absolutely.
And I do really feel that you care. And I know this is a difficult subject, but there are some very, very large channels out there, and we need to talk about it and not be frightened to talk about it, because this is important. And we talk about, why are we doing this? Why am I doing this interview with you now? It's because I'm really concerned about this space that we're in, this media landscape where we don't know what to watch and trust, and we end up watching the same thing over and over again. So a lot of my followers, for example, may watch Dr. John Campbell or Russell Brand, and then they don't watch anything else. And they can't understand a different perspective. And that's what we need to look at. Bring these communities. So a lot of people that followed me, because I was outspoken, I didn't have a good lockdown, okay? I didn't like lockdown. I didn't agree with lockdown. And I grew a very big following, talking to some high-profile individuals like Dr. Roger Hodgkinson or Dr. Mike Yeadon and BBC presenter Sue Cook, Dr. Rennie Hundekamp, Dr. Rick O'Shea, who was a GP in Cardiff, who used to work for the BBC. So many. There were so many interviews. Grew a really big following. And but then they also expected me to be anti-COVID vaccine. Now, I wasn't. I put information out. People like Dr. Robert Malone or Sukrit Bhakti. There were numerous people that came forward with concerns about the mRNA vaccine and how quickly it had been rushed to market, really, given to the population. So I put information out. But all I was ever really championing was information being out there that we could discuss and then make decisions based on that. Because you can't pretend. I think a lot of big media brands like the BBC or Guardian or whatever, or Sky or ITV think we're not watching YouTube. Well, yeah, we are watching YouTube, and Dr. John Campbell's videos are getting 1 million views. And you've got the likes of, and this really is what led me to get in touch with you and to think about doing this podcast, is I read an article in The Conservative Woman, and also I'm obviously aware of the YouTube channel Dr. John Campbell, and Professor Angus Dalgleish, who is an expert in immunology and a professor of oncology at St George's Hospital Medical School in London.
Yeah, I think
linking the booster to cancer.
He's an oncologist. Rather than an immunologist. He's an oncologist.
An oncologist.
Yes.
So they've called him an expert in immunology on the Conservative Woman, I believe. I hope I haven't got that incorrect. So I've taken it off their website.
Mm-hmm.
But you're saying he's an expert in cancer then?
Correct.
Okay. So I looked at that and I thought that's scary, actually. So who's gonna do? I mean, we've got Dr. John Campbell and Russell Brand and GB News, I think, maybe have done something on this, or Talk TV possibly. But my followers are very concerned about this issue with the vaccine and excess deaths. And I do occasionally get messages from people who are broken and they trust me and they say, Anna, what's really going on here?
Well, let's discuss
what's really going on.
Because I think we're here. We're here to inform, advise, educate, and remove that fear. And why are we doing it? Well, because we care. No one's paying me to do this. I'm not in the pay of anyone. This is not my job description. It's not in my pay for me to do any of the media, and it never has been. So why am I here? I'm here because I wish to inform, advise, educate, and it is my field of expertise. This is what I do. I am a infectious disease control expert. That is what I have trained to do.
I interviewed someone called Dr. Roland Salmon from Public Health Wales.
I know him well.
Do you know him?
I know him well.
He spoke
we
out,
worked
and it was
together.
it was in the BBC.
Mm-hmm.
You know, they did cover his view because he did not think lockdown was potentially necessary. The second lockdown, I would say, and also that the vaccines weren't necessary to be given to children. I'm also aware there's some people, journalists I know, who have that view. Very, very
Strongly
high up
held
in the
views.
TV industry.
Yes.
And one particular daytime programme said that he felt the same, that the second lockdown wasn't necessary and we didn't need to vaccinate children. So I think that was Dr. Roland Salmon's point of view. So he would have been the spokesperson for Public Health Wales if he had retired.
He had retired. He had
retired.
retired.
So
because he's from my era. We worked together.
Do you agree with
So,
that?
no, I don't agree with him. But let me digress and explain a little bit more. Hindsight is a wonderful thing. And remember, when the pandemic struck, we knew very little. We didn't know what we know now. And we didn't know exactly how the health services were going to cope with the excess number of patients were there to be generated and needed hospitalization and specialist input. Okay, and the easiest tools that were available were to reduce the transmission of infection. So the more interactions you have with fellow humans, the greater the chances you have of meeting someone who was without symptoms, without any signs, but was nevertheless infectious. And then you pick up that infection and you go and generate a few more cases as you propagate that infection. So earlier on, whilst we were working in the darkness, we had to reduce the number of people who were infected and needing hospital care, because the hospital systems, like what happened in India, can easily become overwhelmed. So you would have heard our chief medical officer talking about we want to flatten the curve. And flattening the curve is exactly that. So if you have a steep rise in the number of cases, what will happen is after a break point, the other cases just cannot be managed because there is no capacity. There's no healthcare staff, there's no beds, there's no hospital capacity, nothing. So what we did was reduce human movement in order to flatten the
Well, I
curve.
remember it very well. And I remember being stuck in my kitchen. And I remember the very first YouTube video I did, that my YouTube channel took off, actually, because of the censorship of 2 Californian doctors. I think they had 4 million views. And that was the bit I wasn't happy or concerned about.
Mm-hmm.
And then obviously you had things like the Great Barrington Declaration. And what concerned me is particular individuals were smeared. So Martin Kulldorff, I think they did an article on him in The Guardian, and they were continually smearing the people calling for focused protection. So what I'm concerned about, what I want to focus on, well, first of all, I don't think people want to talk about lockdown. I don't think I think they completely turn off, actually, first of all, because whether you had a good lockdown or a bad lockdown, it was a very strange time, wasn't it? For all of us. And do you think a little bit like the war? Or I'll give you a story. My uncle was a sub-editor of the Gloucester newspaper, right? And when the whole Fred West stuff came out, the serial killer in Cromwell Street, no one in Gloucester would buy the paper if Fred was on the front page, because they were horrified, disgusted, shocked, ashamed, traumatized. They didn't want to talk about it. They didn't want to go over it. And I'm wondering whether that same kind of thing may be happening, because I was watching an interview you did on Talk TV talking about lockdown, and I felt I don't want to talk about this anymore. I don't want to hear this anymore.
And I hear you, because it was a awful time, especially for people who didn't have that space. You know, everyone's indoors, and the narrative was awful. The UK government could have done a much better job of communicating why we are asking you to reduce your human-to-human interactions. And I remember asking and challenging and debating and conversing with my fellow colleagues, which was, is all of this really necessary? What I'm trying to say is this. So I remember in all my interviews, I used to say, look, as long as you keep away from fellow humans, you're fine. You're absolutely fine. So what was the agenda when they said you can only have limited time for outdoor activity and exercise? I never understood that, because, for example, if you wanted to leave your home and go for a walk alone, or go for a walk with people from your household with whom you're already
in a bubble with.
And you wanted to go for a 10-mile walk, there's no harm done, because your bubble is traveling along the path as your bubble travels, and you take your walk, you have your fresh air, you have your exercise, and you do no harm to anyone. I never understood that. I'm not the lawmaker.
That's what caused the problems, because it didn't really make a lot of sense. We got into a very strange place there.
Well, it was what I would say, use that expression, sledgehammer to crack a nut, because our leaders couldn't be bothered to distill the advice properly, because they didn't trust the people to understand that actually, if you restricted yourself to your few people that you are with, i.e. family members, you're not going to infect each other, and you will be fine. And that narrative was never...
That's great. There's lessons to be learned. It was handled badly.
It's very badly handled. It can be done better, because...
What's going to happen when there's another one? What's another crisis? Because we're not going to trust. We're going to think, this was an overreaction last time. What do you... it's very important that the public trust the people in charge to make decisions in their best interest.
Sure. But Anna, before we go there, let me reiterate this. This is awful. And this is not something we can say, we can do better next time. It is awful. Let me explain why it is awful. This is the United Kingdom. We have an educated population. We have people who can read and write. We have people who've gone to school and colleges, mostly. So to treat an educated population with a sledgehammer cracking a nut was a big failing. And I take part in what we call emergency preparedness planning. So when we did our emergency preparedness planning, we go through scenarios of what may happen and what will we do. And all those scenarios of what may happen and what will we do never said we are going to keep our population under prolonged shutdown, restriction of movements and restriction of interactions like we did. And what we were doing during the pandemic was making it up as we went along. And it is awful to make it up as you go along because there is a reference point. The reference point is, what did your emergency preparedness plans say you would do? So refer to that page, that chapter about under this circumstance, what did we agree and say we would do? Tinker with it, modify it a little bit and say, this is what we advise you. Instead, all those emergency preparedness plans, on which, by the way, we spent millions in preparing and planning, were thrown out of the window and new plans were being made as we went along.
But the problem we had was what the government's saying wasn't make sense. So they'd go and find a place that did make sense. So they'd look at, people like Dr. Mike Yeadon was speaking out. So when the second lockdown came, there would be no excess deaths. And it didn't make a lot of sense to a lot of people. And it came out in the WhatsApp messages that Isabel Oakeshott leaked. Do you remember those and the actual conversations like Gavin Williamson, the Education Secretary, being concerned about school closures? Even our own Prime Minister Rishi Sunak was talking about the concerns over school closures in the second lockdown. Are we just focusing on the economy? He was talking about what about school closures? It was in the an article in Spectator in August 2022. And it seemed that at the time, a lot of people had concerns about the second lockdown and school closures, for example, but we didn't know about it at the time. They had to have a unified front, I guess, the government, in terms of what they decided to do. But it was wrong. Do you remember when we didn't know whether we were going in or out of lockdown? And that was, for me, personally, I found that traumatic.
Uncertainty, of course. And
am I able to get my life back now?
Yeah. And
am I going to be shut in the house? Are my children not going to be able to go? They tied up the swings in Wales.
Yes.
They cordoned off the toy aisles. You know, and it was my daughter's birthday, and if I didn't have access to online, being able to buy something online, she would have had no presents at the birthday.
Yes.
And this is therapy we all need to look back.
Absolutely. And don't forget, Anna, there are lots of grieving people who lost their loved ones, their grandmothers, their grandfathers, their uncles, their aunts, their parents. They died alone. It grieves me because this was never in our plans that, under certain circumstances, your loved ones will die alone. Who made up all those rules? Right? It just happened that, sorry, you can't see them. Your mum, your dad, your father, your brother is in hospital, in ITU. They're taking their last breath. And we have our political leaders. They have the temerity to use expressions like last gasp. I recall hearing about their WhatsApp exchanges. So,
my father, just imagine if he was dying, and not being able to hold his hand.
It's awful.
And
it's
how
awful.
can you recover from that?
Yeah, exactly. So, and I hold our political leaders responsible, and they shouldn't be allowed to get off with, we prepared for influenza, but this was SARS-CoV-2, therefore we were unprepared. That is nonsense. It's absolute nonsense because the pattern of transmission for influenza is similar to SARS-CoV-2, meaning it is airborne. So the simulations, the pattern, the spread, the tidal wave of cases is very similar. The R0 and the case fatality rates between influenza and SARS-CoV-2 are different. Sure, we know that, but the pattern of transmission, the way it appears and then it infects a few more and so on, is similar. So for politicians to have the get out of jail card, which they try to use, and journalists, because they have not done their homework, don't challenge them and say, listen, you prepared for pandemic influenza exercises, exercise sickness, etc. And the pattern is airborne transmission. So you knew what to do. And now you're telling us we didn't know what to do because it was SARS-CoV-2. You're lying.
Do you think, though, if you have been a victim of so, for example, my dad died and I wasn't there, the only way you're going to be able to move on is to heal, is to forgive, do you think? Because just to understand there were lots of people involved in this decision making, and it was a very, very difficult situation that was changing, and to be angry, to point the finger doesn't help repair and heal for the future. And that's what concerns me, is these people that contacted me, and there were thousands. They were heartbroken.
I am.
So how are we going to move forward? Say, how are they going to have hope again in the system? So, we've seen mainstream media, mainstream education, mainstream government, mainstream health be challenged, and a load of people go into alternative media, alternative health, alternative education.
So let me try and address this. And I'm no expert in how do we move forward, but this is my personal analysis. And my personal analysis is as follows, and I want to quote, because I remember this so well, Mark Tully, Something Understood. He used to do these little broadcasts for BBC World Service. It was always on a Sunday, and was called Something Understood. And I clearly remember this. So Mark Tully said, if you remain angry forever, and if you don't forgive, and you don't come to terms with it, you harm yourself. You're only hurting yourself. So my advice to people, I learned so much from that one podcast from Mark Tully. So my analysis and my answer is as follows. We must learn. We must not forget. We need to hold these people to account. But personally, we try and say, I have tried to make amends, and I now need to lay it to rest because I've done my best to address this issue. So if you are educated and you can write letters and you can articulate yourself well, then write a letter. Write a letter to the Prime Minister, write a letter to the newspaper, write a letter, write something, say something, get it off your chest, and then lay it to rest. Yeah. But don't allow it to fester such that it consumes your every waking hour. That would be my one suggestion of how one can move on. You need to forgive. You need to move on. How do you do it? It's not easy.
There's so many people that I see on Twitter who still talk about what happened all those years ago, and it's upsetting for me because I think they still feel so frustrated and concerned. But at the same time, you have to live your life and find a way to move forward.
But I always say, look, don't push it under the carpet. Don't forget about it. Don't say, oh, well, we need to move on. Do something about it. And when you do something about it, you will actually feel automatically, those chemicals that are fighting you and making you ill somehow subside in your brain, and it allows you automatically to say, I did my bit and now I can move on.
Yeah. Well, listen, we need to go to the questions that the public want me to put to you from that post that about excess deaths, and is the COVID vaccine causing excess deaths in particular. Like I said, I don't understand how we could ignore, Professor Angus Dalgleish talking about the concerns and the links between some cancers and the vaccine. And I know I believe there's a GP in Guernsey who's raised concerns as well.
Well, look, let's try and address this, okay? And what I want to say is this. If Angus Dalgleish has got concerns, there are ways of doing it. Turning up on Talk TV or LBC or wherever isn't the right way. So if in your clinical practice you are seeing something unusual and different, then we have what we would call networks. In other words, there would be other oncologists, there would be other centers all over the country, everywhere, and you would say, I noticed this. What do you notice? What are your observations? What have you found? this is what I am seeing. What are you seeing? And then you get together. And even if you can't get together because you are too busy in your clinical practice, you've raised a flag. You've raised a flag. You've got your, what we would call your royal colleges. So you have the Royal College of Pathologists, Radiologists, Physicians, Surgeons, etc. You can write a letter to them and say, this is worth looking at. I haven't got the necessary ability, the skills, the tools, or the manpower to undertake a proper research study to see if this is apparent or real. Rise in untoward things that I am seeing in my clinical practice. Now, as far as I'm aware, the people from people like was it Dr. Douglas, you said?
Professor Angus Douglas. But from what I can gather, I mean, people have come forward, other oncologists have come forward, and I mean, he published an article recently on April the 15th, and it says, massive cancer death study vindicates my warnings of the COVID boosters.
Look.
We need to get to the bottom of this. I mean, I don't understand.
Look, there are processes, there are ways of doing it.
Okay.
Listen,
what we can do is put this to, I will put this to Professor Angus Douglas.
Sure. What one would do is you have your network, okay? Talk to your network, collaborate with your network, talk to your royal colleges, talk to your local university, talk to university experts, undertake a proper study and work out, is this real? Is this related? Is this cause and effect? All of this should be done in that systematic way. Otherwise, what you are doing is raising a flag and causing concern. It may be real concern. It may be you thought it was a concern. It may be of no concern. But the right way to do it is work professionally with your colleagues, with your colleges, with your university, undertake a proper study, get that study published in a peer-reviewed journal. This is important. The study published just because you picked a journal isn't right. There are steps, there are processes. So have it independently verified and published in a peer-reviewed journal. A peer-reviewed journal is, look, you present your your study, you present your findings, you present your methodology, you present how you come to the conclusions that you come to, and then get independent, neutral people to analyze this and say, we have a problem, or we have not got a problem. Do you follow? So that is the smarter way to do it.
I think that journey, I believe he has gone on that journey. One of the sort of criticisms or concerns is that certain media brands aren't running it. But then it probably hasn't passed the test. I mean, in terms of journalism, and that's the whole focus of what I do is it good journalism or bad journalism? I think good journalism, though, allows the conversation.
Sure.
Let's have a look, let's have a look in a conversation. Is there any truth to this? You have to be frightened. If you're frightened of having the conversation, your trust and your brand, I think, will be impacted. I think it's when you insult the intelligence of the public and say, they obviously have YouTube, yeah? They have YouTube, they have other media outlets that they can read information from where people come forward. And that was one of the big problems during COVID, I think, is they were seeing a conversation around focus protection from the Great Barrington Declaration, but then no conversation on any of the other big media brands that they're trusted for so long. And even from the government, come on, just don't insult, just don't treat us like children, okay? We can do this. We're grown-ups, yeah? Maybe the vaccine has caused problems. Maybe there were some bad batches. Is that possible? Maybe it was very appropriate for the vulnerable and the elderly, but not suitable for the children. But it seems everyone's black and white on these issues.
So let's, again, it's very important to be non-sensationalist, okay? Because our customers, our people, are the general public. And we do not want to cause unnecessary worry, anxiety, such that they're taking this concern to bed with them every day. So it's very important to be responsible. So talking about the vaccines, they were not shortcut. They were not shortcut and rapidly rushed out, as people say. All the gates were opened and the gates were enabled. What do I mean by gates and enabled? I mean this. Normally, to get a theory into practice, into production, into it works, takes a long time because these gates, as I refer to them, are closed. What are these gates? Well, things like, I remember doing my own research work, and it took so long, for example, to get ethical committee approval. It got so long to have funding, so long to have the right number of patients recruited into the study, and so on. Whereas in this case, all those gates, all those restrictions, all those things that take time were enabled. That is what speeded things up. And then furthermore, this mRNA vaccines isn't as super new as you think it is, because the methods, the science had already been tried with the manufacture of the Ebola vaccine. So we knew when we created the Ebola vaccine that it is possible to have antigens, as we call it, introduced via the mRNA route. M stands for messenger ribonucleic acid route, to create the antigen, which then creates the immunity, which then allows you to fight off this infection. So that was tried and trusted care of Ebola. And then SARS-CoV-2 arrived, and the emperor has no clothes. So, for example, with influenza, we make the vaccine in chick embryos, eggs. Okay, so in hen's eggs, we incubate the virus, then we grow the virus, then we harvest it, then we break it up into little pieces, and then we take the relevant pieces and put it together and make the vaccine. Well, when you've got a raging pandemic with an R naught greater than that for influenza, and it is happening, what do? You say, well, let us try a route that would give us a large number of doses of a vaccine that is safe, has been tried, but we're nevertheless going to try it. So Oxford, AstraZeneca, Moderna, Pfizer, they all did their trials. And having done their trials, number one, they worked it out that this messenger business does work. It does induce immunity, and that it has a protective effect. And then, it passed through all those scrutinies, and then the rest is history. So we said, without those vaccines, absolutely, we would have a lot more deaths.
From my, I always put myself into the mind and the heart of a member of the public. The problem I have is I have seen Dr. Robert Malone and Professor Sucharit Bhakti saying the complete opposite to you. And again, like Roland Salmon, for example, who was at Public Health Wales as a spokesperson, said the complete opposite to you.
What?
So no, all I would say, I don't want to talk about vaccines. I don't want to talk about lockdown. I want to talk about, I am confused. I'm a member of the public. And in fact, I'm so confused, I'm going to ignore all of you and just look around. So for me, no, I didn't know anyone who died of COVID, and I don't know anyone who's had a vaccine injury, because I actually don't know what to do now, because I don't know whether to trust you or Professor Sucharit Bhakti or Dr. Malone, or I am very confused. Or there's a big list of names here.
Okay.
All these different people. There's so many of them. Peter McCullough's been mentioned a lot.
Let me try and answer this. Let me try.
Okay.
So, again, I feel there's a little bit of a failure of central government. What I mean by that is, under such circumstances, what you really need is a trusted scientific officer, like the chief medical officer, like the chief scientific officer, or similar from UK Health Security Agency, formerly Public Health England. That trusted government, but independent of government. This is really important. Trusted, independent of government, but, in that main office, chief medical officer equivalent, that sort of thing, being the talking head and giving out, this is what it is, this is how it works, This is how it's developed. This is why we're doing it,
It'll work if
etc.
it makes sense, yeah?
Yeah, yeah.
It's got to make sense. So like you said, going for a walk, not
Yeah.
being able to go for a walk in the fresh air,
Yeah.
that didn't make no sense. So it's always got to stay.
Yeah, exactly.
But there's a lot of things that didn't make sense. Like the swings, tying up the swings.
Yeah, no, but Anna, let me answer. So I'm saying that was a huge overreaction everywhere. And the people who really know the science were not talking about the science. And nature abhors a vacuum. And when the people who are really in the department, who are supposed to talk about the science and what we're doing and why we're doing it, we're not talking. So then we get other people taking that stage and saying, in my opinion, it should be like this. In my opinion, it should be like this. And then we create that confusion and we don't know who to believe.
I didn't know who to believe, so I didn't take the vaccine. I didn't take it. And I believe at least 10% of the population, because I didn't feel that I trusted the government anymore and the messages that they were giving because of the total cock-up, and I will call it that, of tying up the swings and all the other weird stuff. I thought this doesn't make any sense.
Yeah, it was, as I say...
and that's the problem. If you can't trust what happens if there's another one, yeah? And that vaccine's going to save lives... It could be devastating, couldn't it? I mean, this is serious. This trust issue.
It is a big. It is, but we have. It is very regrettable that the United Kingdom of all people messed it up so much. It's unbelievable. So in early 2020, if people had asked me, how will the UK do? My answer was and would have been, and I know it was, don't worry, the UK is one of the best in the world for emergency preparedness. We will come out of this very well because we know what to do, and the UK is very good with such things. Then in about March, April 2020, I began to realize that all that planning, all that preparedness that we were doing had been cast aside and we were making it up. And then I started to feel that anxiety of where are we going? Why are we so unprepared? Why are we so underprepared? Why are we...
Why are we losing trust with the public?
Well, exactly. So why are we...
I can tell you why, and I can tell you the solution as well.
Introducing restrictions, removing restrictions, introducing restrictions again, having those tiers, having those multiple complex systems.
It wasn't easy. What they needed to do you remember the press briefings when all the different journalists would come and ask questions?
Yes.
I think it was very simple. It was to have independent journalists.
Absolutely.
Also asking questions.
Absolutely.
Yes. That would help, wouldn't it? Because we weren't.
It was very stage managed.
A question, and I'm not here. I'm not hearing these journalists like Laura Ginsburg ask my question here.
Yes, but
stage managed. Yes.
Also, one more thing, Anna, on those daily presses that we used to have. It's not my place to advise the chief medical officer, the chief scientific officer, but if I were to give advice to them, this is what my advice would be. Sir, you are independent of government. If you do not demonstrate that you are independent of Johnson or whoever is the Prime Minister, we start losing faith in you.
Brilliant.
Right? So, sir, you made a mistake going to those presses with Prime Minister Johnson or whoever in the middle, and then you'd have Valence or Chris Withy or others.
With the Prime Minister.
With the Prime Minister.
They looked like they were with the government. So
science
wasn't separated from politics.
So
it's the same with the BBC, I guess.
So look, I know this because I've done a lot of this. When Health Protection Agency was created, the chief executive of the Health Protection Agency was somebody called Dr. Pat Troop. Now, she was an expert in my trade. Okay, so she was the chief executive, but as she was an expert too. And then we had the polonium-210 incident. Remember that polonium-210, where this gentleman, the Russian person had been poisoned with his tea, and there were traces of radioactive polonium in Itsu, the sushi bar, and the British Airways aeroplane, etc., etc. Pat Troop held those press conferences on her own as a stand-alone expert on what we are doing with all this radioactivity that has been found in various places. And that was brilliant. That's the way it should be. So the CMO, Chief Scientific Officers, ought to retain their independence. I know the politicians take the final decision, but we want to hear from the CMO and the Chief Scientific Officer without the headmaster, meaning the Prime Minister or his ministers, looking down upon you, because we can see, we can sense that you are censored in what you would like to say when your headmaster is overbearing over you.
It was the same with the BBC. We really needed to feel that they were asking the important questions that the public wanted to ask.
Well, I do feel, maybe...
just giving out what the government wanted, it didn't feel like...
It didn't feel like it.
Were...
I agree with you. So, talking about the BBC, I feel it is in a tough place because whilst it is supposed to be independent...
it relies on the government for the licence fee, I guess.
It relies on them, but not only that, they get that phone call saying, we don't like your approach. We don't like the way you questioned the minister. We don't like your aggressive tone. So unfortunately...
Do you know what happened? This is very important. People don't know this. So I did an interview with David Rose, who was at Mail on Sunday. He's a freelance journalist. He was also at The Observer. And he said, if you don't play the ball with the communications... guys in the hospital or the health, as a health correspondent like you, Pim, I mean, you don't get access. You get punished. So
yes.
We're not going to give you that interview. Then
Correct.
You're not going to be able to come and do
yes,
this.
Yes. So
they'll punish you.
So
people don't really know that, do they?
People don't know that, and people need to know that you get punished for asking awkward questions. You get punished for being awkward. However, get punished. You are here to do a job. You are not here to ask the simple question with no follow-up. You need to do your homework. You need to really know your stuff. And if you don't know your stuff, and you're not expected to know your stuff, you're a journalist, then pick up the phone, call a university and ask the university, I want an expert to brief me on this. And listen, I used to get journalists call me and say, I'm going to be on the presser, what should I ask? And I used to not say, ask this. I would say, ask this because of this, and this. And unfortunately, it's so tragic that they never got the chance to have the supplementary questions, because you get one question, one answer, and then you can't interrupt and say, but you haven't answered that question properly. All right? Which is, again, it is staged, managed, because I think... If we need to restore faith and trust in government and ministers, then ministers need to sort of acquiesce that they are going to be grilled and they are going to allow supplementary questions, and non-answers are going to be called out. In other words, many times on those presses, you got non-answers to a question, and you couldn't say, sir, that was a non-answer. You have not answered my question.
Well, what I do as a journalist as well is I read all of the comments and listen to what the public want to know.
Mm-hmm.
That's really what your journalism is as well, isn't it?
Well, yes, but...
Because there's so many now. You've got hundreds and hundreds and hundreds of comments. And some of them, Twitter, I wouldn't say I rely on so much because there's lots of fake accounts on there, but you get a feel of what the questions are from the public. There's just, so yes, that's really, but I don't think people completely understand. I don't understand your job, and I'm not, I'm never going to understand immunology and virology, etc. But I do need to,
and the difference between the two.
I need to need to know. I do need to trust the people in charge making important decisions of my health and my children. And when this happens again, it will happen. Something
of course it will
happen again, won't it?
Of course, and we have lost trust. And I think...
This is really important.
Look, on a separate matter, we have PMQs, Prime Minister's questions, And therein is the nub of the problem. Therein is the boil that needs lancing. It is a show. It is a drama. I'm an examiner. If I were examining PMQs, I would say fail, fail, and fail, because a question is asked and the question is not answered. And we can't carry on like this. What is the purpose of PMQs if you will ask a question and the question will not be answered, and the Speaker of the Speaker of House of Commons, he's supposed to be conducting the orchestra, so to speak. He doesn't stand up and say, Prime Minister, with respect, you have not answered the question. Will you please answer the question? That's the starting point. And then similarly here with scrutiny, radio, television interviews, these are staged, managed answers, and they're not answering the question. They do that typical journalist thing, which is they pretend to start answering the question, and then they cross the bridge, and then they go off and say something.
Spend a lot of money doing this media training. I do that.
Yes, and you can and you can tell who's been so seriously media trained.
You can see, obviously. Yeah. Well, I'm going to ask you a direct question. What's causing these excess deaths?
Can you refine it a little bit more?
Because that's what people want to know.
Yeah.
Okay,
so let
Richard Adams has said, is it even a question? He's given up even asking the question now. He said there is a stack of peer-reviewed evidence, experts and data that show that the vaccines have caused huge damages to health and even deaths, and continue to do so, with myocarditis, heart-related issues in young healthy males off the scale. It's a disgrace. The so-called MSM are rooted in denial on this out of fear from their globalist paymasters. Thank God for Andrew Bridgen, one of the 20 MPs doing the right thing. Truth will prevail. It always does. You know, these people, these politicians and these individuals exist, and people, they don't listen to you. They listen to them because they do have a lot to lose as well. I mean, you had no reason to do this interview, but they look at these people like Andrew Bridgen, but Peter McCullough, Pierre Corey, Claire Craig, Jay Bhattacharya, but these are different issues. There were a lot of you can feel that they genuinely are really scared, and I really believe these people really care about me, and there is a problem here.
But let me answer. Come on, let me answer. So this is important. The vaccines which were deployed globally, all over the world. It's not only a UK or a Europe thing. All over the world. Created a protective shield from this virus, which was especially in vulnerable groups of people and the older age group, creating phenomenal mortality. Okay, we have proven that the vaccine gave you that protection. Now, without that vaccine, a lot more people would have died. If your assertion is that we have excess deaths, then there are many, many causes for excess deaths. And one of the causes of reduced life expectancy in the UK, for example, is poor healthcare. Right? The healthcare in the United Kingdom has not had the investment for the last 20 years, not 15, 20 years, comparable to our fellow European countries. So we have poor access to general practice. We have long waiting lists. We have people who say, it's subliminal. I won't bother the doctor because I can't get access to the doctor. And is it any small wonder that therefore you get more deaths from your strokes, your heart, your cancers, your late diagnosis, your diabetes? It is not a small wonder at all, because there is an issue of poor access to healthcare facilities. Now, let me answer it, because I'm answering it truthfully for you, Anna, which is, if your question is, you didn't ask it in this way, but let me put it this way. If your question is, are the vaccines killing the people? Let me say it to you very clearly in simple English. No. The evidence is very clear that the access deaths are not related to the deployment of the vaccines. If anything, the vaccines have saved lives, especially in the vulnerable older age groups who would otherwise may have succumbed to this infection. So let me repeat again. Did the vaccines kill people? My answer is no. Did the vaccines save lives? Yes. Do we have reduced life expectancy in the UK? Yes. Are we having problems with late diagnosis of conditions? Yes. Do we have problems with access, timely access to general practice, timely intervention, early intervention, such that you end up with being saved rather than being critically ill and then dying? Yes, we have all those issues. Now, let me just digress just a little bit more, right? Because I've been in this business long enough. Serial governments, Labour and Conservatives, have tinkered with the healthcare system because they don't want to do the right thing. So let me give you an example. The Blair government, instead of investing in general practice, I used to be a GP, so I know. Instead of investing directly in general practice, they say we will invent something called NHS 111. And the NHS 111 works to an extent, but it would be... Remember, NHS 111 is looking at an algorithm. It's not a doctor who's going through your signs and symptoms. It's a non-medical, non-healthcare person going through a chart, a flow chart. And that flow chart invariably ends with go to hospital, go and see your GP. Whereas if that money had been invested in properly trained healthcare workers, doctors, GPs, nurses, etc., that would be money better spent. An example. Then we have fiascos of we're going to make it better. This is Matt Hancock's baby. We're going to make things better because I'm going to invest in IT. And then the IT project, billions of pounds thrown into the bucket because it didn't work. So we have tinkering in the healthcare system, wasting money when actually if you had got somebody who's actually done the job advising and saying, my advice would be like this. Invest in public health. Not because I'm a public health physician, but I know that if you invest in public health, the rewards are 20 years later. Politicians work in 4-year cycles, so no wonder they don't do it. But if you invest in, for example, let me take the example of some European countries. They have swimming pools, they have gymnasiums, they have access to fresh air, they have access to exercise. If you invest in good diet, good school meals, the first 10 years of a child's life, traffic, housing, exercise, swimming pools, all those things, what do you get? You get a healthier population. If you get a healthier population, you get fewer ill people. Healthier population work. Healthier population work, they pay taxes. Taxes generate income. Income can build hospitals. So our politicians who work in 4-year cycles have got it all wrong. That is the issue. And that is the reason why, if you would read the Marmot reports, and I say, please, to yourself, your followers, etc., read the Marmot reports, okay, which clearly show why the UK's health is deteriorating and what the issues are.
Thank you very much for coming and talking so honestly.
Thank you.
And I can see that it's something that you're very passionate about. Like you say, why else do this? You know, why am I here? Why am I talking to you?
Yeah, and nobody pays me for this.
I tell you, I mean, nobody's paying you. No one's
Sure.
paying me. You know, this isn't sponsored. You know, I do workshops. You know, which I feel are really important because citizen journalists or everyone is a content creator with the ability to impact and influence society with what they share and comment on and produce. And I do feel very passionate about giving them some professional skills and helping them to shape the media agenda and things like gaining a right of reply and not always doing, if you've got a podcast or a YouTube channel, talk to people that you disagree with, have those challenging conversations, you know what I mean?
Sure.
Because that's going to be more helpful, I think. You've got a diverse community then, you're not watching the same thing that keeps, the problem I've had about this talking about the vaccines not causing excess deaths, that you've said very clearly what your position is. I know there are some people that will listen to that. You just won't. They've just done that.
I know,
They
which is
wouldn't
such a
listen to
pity.
anything you said.
I know.
Because they've made up their mind, because
Yes.
every single day they watch the same kind of media content
Yes.
that tells them that
Yes.
that these vaccines were deliberate means to cause deaths, to depopulate the earth, and
It's such a shame they
that's
feel
what they
like
listen
that.
to over
I
and
know.
over again. So it was, if we'd had more of a mix-up on YouTube, I think, on the new media platforms of different voices debating this,
But Anna,
without
also,
being shamed and
Sure,
smeared, and
sure.
because that's really unhealthy.
So
isn't it?
take my own personal example. I do what I do. I work at the University of Exeter. I teach, and that's what I do. I don't know media. I don't know YouTube. I don't know all these things. And perhaps you've hit the nail over there, which is that maybe people like us also need to realize that we shouldn't sit in our rooms doing our work that we've always done, but that learn communication skills and communicate with the public out there and learn how to do it. By the way, on the subject of I'm at Exeter Medical School, you said at the beginning I'm head of public health something, and I just want to correct that, because since I've cut down my commitment considerably at Exeter, I just need time for myself. So now I do very little at Exeter. I'm not head of anything.
Okay,
Yeah,
fine.
yeah, just
Well, I
for
can always
the
edit that out,
record.
but thank
Yes,
you for
please.
correcting that.
Yes.
So listen, I just want to say thank you so much for talking to me, and
We should have more conversations.
I would love to.
And I think if we, through just having a conversation, can remove that fear, that anxiety, that worry, allow people to come to terms with things, sleep better at night, then we've done something right for the people, because we care for the people.
Exactly, we do care for the people, and I want them to have peace.
Yes.
I want them to have peace and know a trust in
Yes.
what they're hearing, and to have hope for the future, and to still believe in democracy.
Yes.
That's very important to
Yes.
me. And I think some big YouTube channels or influencers saying that you can't have a say anymore. You can't trust democracy. Your vote doesn't matter. There's these dark entities that are completely controlling your future, and you've got no say. That is such a depressing message.
On that subject, it's high time we ditched the first past the post electoral system. We need proportional representation.
Completely agree.
Because when people say my vote doesn't count, I hear them. I hear them loud and clear. And then people feel disenfranchised. And I think politicians with their own vested interests should not have the permission to dictate what sort of electoral system we have, because they choose the system that suits them. We need a revolution on that subject. We need PR.
Well, listen, thank you ever so much. I do
You're
hope we
welcome.
speak again.
I hope so
important
too.
topics, I think, that we've covered there. And, there must be some people who think I've let you off the hook too lightly, but you gave your answers robustly.
Honestly.
From the heart.
And I have no agenda. Nobody's paying me.
Well, listen, it's hard work. You get and we've got to be aware of the comments, things like, why choose this man who thinks the MRHA is excellent, fit for purpose? And it's people say to me, it's like you're still picking up a wage from the BBC, pretending that you're unbiased, me. So we do get, but you have to have a thick skin, because this is important work, isn't it? That's how we build trust. So thank you very much.
Welcome. Thank you, Anna.